Okay, cranial nerve number 1 is olfactory. So we should have the patient smell something, although sometimes in the acute care setting, this is not really done. So can you occlude your right nostril, please? And close your eyes and tell me what you're smelling.
Toothpaste.
Okay, now the other side, please. And tell me what you're smelling.
Toothpaste.
Okay, so that olfactory is intact. Now for optic, we could do the Snellen chart, but in this case, we don't have a Snellen chart, so we're not going to do that. So we're going to do his perla. Look straight at the tip of my nose over here. Good, and I'm also checking for consensual light reflex. And then look at the pen right here. And then look at the ceiling over there. Okay, so the pupils accommodate. Now for cranial nerve 3, 4, and 6, we're going to check his extraocular movement. So with just your eyes, follow my pen, please. When you do that, make sure that you go nice and slow and you don't hold the light too close to the patient's eyes, because that can get pretty disorienting. Okay, so here we are 3, 4, and 6. Cranial nerve number 5, trigeminal, has 3 branches on the side of the face. Can I have you turn your head over this way? And the 3 branches run right here on the forehead, on the cheek, as well as on the jaw. So trigeminal, you can remember it, 1, 2, and 3. And it is a sensory nerve, so we'll assess the sensation. So have you turn your head back over this way. Can you feel me touch you here? And is it the same on both sides?
Yeah.
And then how about here?
It's the same.
And here?
The same.
Okay, very good. Now, show me your teeth. Raise your eyebrows. Puff your cheeks. Okay, puff your cheeks again. And don't let me push them in. Good. Close your eyes real tight, and don't let them open. Okay, very good. Now, I'm going to whisper something in your ear and repeat back what I say, please.
1, 2, 3.
Okay, and let's see the other side.
7, 8, 9.
Excellent. So that's the acoustic nerve with his hearing, although I have already assessed by just speaking with him and him following my directions. So cranial nerve number 9 and 10, glossopharyngeal and vagus nerve, can be combined, and that is assessing the pharynx and the larynx. So can you swallow for me? Okay, very good. And then we're going to take a look inside your mouth. Open up, stick out your tongue, and say ah. Okay, keep the tongue out and move it left and right. Okay, very good. So we'll check the tongue movement there. And then we're going to check the spinal accessory muscle, which is cranial nerve number 11. Shrug your shoulders, please. Good. And then turn your head against my hand and the other side. And we'll compare sides here. Okay. And this concludes the cranial nerve assessment. The only other cranial nerve that we haven't really discussed is hypoglossal, which is cranial nerve number 12. And that is the tongue movement and the articulation with the tongue and the swallowing that I've already assessed by speaking with him and having him swallow earlier. Thanks for watching this video on the assessment of the cranial nerves. Please also make sure to check the other videos in the physical assessment playlist to get familiar with all the different physical assessments that we perform in nursing. Thanks so much for watching. See you soon.
So the next part of the examination is the cranial nerves. We're going to start with discussing cranial nerve 1, or a sense of smell. We don't typically evaluate that as part of a normal neurologic screening examination, but if it were to be done, you want to make sure that you use something like coffee, cloves, or vanilla, specifically a non-irritating odor, as an irritating odor would stimulate a different nerve. So we're going to start by evaluating cranial nerve 2, or his optic nerve. So we're going to start with that by evaluating for visual acuity. We're going to test near vision using the near eye chart. So if you could please take this eye chart and hold it approximately a comfortable reading distance, which is going to be about 12 to 14 inches from the patient's face. If you could please cover one eye, And please read to me the smallest line that you can.
9, 3, 7, 8, 2, 6.
Okay, thank you. Now if you could just please cover the other eye. Now again, read the smallest line that you can, only backwards.
6, 2, 8, 7, 3, 9.
Okay. Make sure when you're doing this evaluation that you can actually see what the numbers that are being read so that you know they're being done correctly. In addition, I always have the patient read it backwards so that you're not using a memorizing effect for the second eye. Remember, this does need to be done one eye at a time. Now that we've done visual acuity, we're going to move on to visual fields. So I'll take that card from you. Thank you. We're going to stand in front of the patient, approximate equal easy arm distance away from the patient. And we're going to test the visual fields one eye at a time. So I'm going to ask you to cover your right eye for me. All right. So I'm going to cover my left eye so that I'm testing the same visual field for myself, using myself as the normal. We're going to do this by using a finger wiggle and seeing when the patient can see when the movement occurs. Make sure you instruct the patient to look straight at you and not off to the side, because again, you're trying to test the peripheral vision, not their central vision. I want to put my fingers at approximately equal distance between the two of us, and when I can start seeing the wiggling, he should be able to start seeing the wiggling. So move your hand out and move it in until he can see it. So please let me know when you can first see my hand moving.
No. No.
Make sure you do both the upper and lower lateral fields as well as the medial fields. Let me know when you can see my hand moving.
No. No.
And then do the same thing with the other eye. Please cover your other eye for me. Blink a couple of times. There you go. Make sure the patient isn't putting pressure on their eye when they cover it, because that will again distort their vision. So again, we're going to do the same thing on the other side, doing the upper and lower, both medial and lateral.
No. No. No.
I'm going to switch hands to do the upper field because it's easier.
No.
All right, so that's visual fields. Next, we need to check the pupillary reflex. Any light source will do. I typically will use the otoscope, but you can use a pen light if you don't have the otoscope available. Again, you need to check both eyes, but you need to check both the direct and the consensual response. Depending on the patient's eye color, you may need to dim the lights in the room so that you can see the actual response. So again, I'm just going to ask you to look straight forward at me. And I'm going to check the direct in this eye while looking at the other eye to make sure it's also responding. And then the direct in this eye and the consensual in the opposite eye at the same time. So a complete evaluation of the optic nerve also includes a fundoscopic exam. Now this will need to be done with the lights down so that the pupil is dilated enough in order for the patient to be able to see. I'm going to demonstrate it with the light on so that the camera can pick it up. So with the fundoscopic exam, what you want to do is have the patient focus on a spot off in the distance and try and continue to focus on that particular spot. So choose any spot on the wall, give them something specific to look at. It's hard to pick and stare at a spot that's just a blank area of the wall as opposed to a specific object. So there's a light switch on the other side of the room, so I can ask the patient just to focus on the light switch. I'm going to evaluate the fundus, again, using the opposite eye to look in his eye, so that I don't come face to face with the patient. So since I'm going to start on this side of the patient. So again, just pick that spot on the wall and continue to stare at it. I'm going to anchor myself on the patient so I have some idea as to how close I am. And I'm going to move in, evaluating the patient's optic disc and the blood vessels, as well as the other parts of the retina. It should only take a few moments in order to do that full evaluation, but make sure you look at both the optic disc as well as the remainder of the retina. And now switch eyes. So again, I want you to again continue, you blink a couple times if you need to from the bright light. I'm going to switch eyes and do the same thing. Anchor on my patient, come in and evaluate both the optic disc as well as the macula. So now what we're going to do is evaluate extraocular movements. In order to do this, what we do is have the patient follow an object with their eyes without turning their head and instruct the patient to do so. You can use any object you prefer. I usually just use my finger. So if you would just please look straight forward and then follow my finger with your eyes, but don't turn your head. What you want to do is have the patient move to the extremes of vision. So out laterally, up, and then down, back through the center again to the opposite side. And this will catch all the cardinal movements. In addition, you want to make sure you test convergence, where you have the patients cross their eyes. So that evaluated convergence, and if I want to also evaluate for accommodation and watch the pupillary response, make sure you're standing close enough to the patient to see the change in the pupil size. So now we need to evaluate the facial sensation, which is part of a trigeminal nerve, which is cranial nerve 5. When we do that, that always starts with evaluating the corneal reflex. However, we only do the corneal reflex if there's a suspected abnormality, and we never do it on standardized patients, so I won't be demonstrating it here. We do need to evaluate, though, the remaining of the sensation on the face, and we need to make sure we cover all segments of the trigeminal nerve. So V1 in the forehead, V2 in the area of the cheek, and V3 in the area of the jaw. So again, I'm going to have the patient close their eyes, and I'm going to use light touch only, and I'm going to touch each segment of that nerve and ask the patient to let me know if he can feel it bilaterally and where you're feeling it.
On my forehead, both sides. My chin, both sides. Cheeks, both sides.
Okay. In addition to evaluating the sensory part of cranial nerve 5, we also need to test the motor aspects of it. So that's going to include the jaw muscles. So what I'm going to ask you to do is clench your jaw tight, and I'm going to feel your face. So clench it for me and relax. And again. So while I'm feeling the temporal muscle, as well as when I'm doing the masseter muscle. And clench it one more time. And so I can feel the strength of the contraction and see if it's happening equally on both sides. In addition, I'm going to ask you to move your jaw back and forth for me. So again, I'm evaluating to make sure that those muscles are functional. Next, what we need to evaluate is the muscles of facial expression, or cranial nerve 7, the facial nerve. So what I'm going to ask you to do is smile real big for me and show me your teeth. All right, you can relax. I want you to close your eyes really, really tight. Don't let me open them up. All right, and rise your eyebrows for me. All right. So again, we've checked essentially a brief screening of all motions of the face. And with that, we can see that they are equal bilaterally. And next we want to do is check hearing, or cranial nerve 8. We're going to do that with a finger rub test. And in this situation, this is a rough screening. Any abnormalities that you get here, you'll need to make sure you send the patient for further testing. So what I want to do is make sure that they can hear a very soft sound in both ears. I'm going to do that with my finger rub. I want to make sure that you do it by yourself to make sure that your finger actually makes noise. If you just lotioned your hands, it may not make any sound. And then let the patient know what you're going to do. This is the sound I'm going to do. What I'd like you to do is tell me when you can hear it on which side. All right? So if you could close your eyes for me. I have the patient close their eyes because I don't want them to use visual cues to be able to tell where the sound is coming from. All right.
Left side. Left side. Right side.
All right. So now the patient has heard it on both sides. So next what we want to do is evaluate for things like from cranial nerve 9, which would include the gag reflex. Again, that will be touching something to the posterior part of the pharynx and seeing if the patient has a gag response. Again, we only do this in a situation where we suspect an abnormality, and again, we don't test this on standardized patients. However, we can evaluate for palate rise by looking at the back of the throat, having the patient say ah. So if you could open up your mouth for me and say ah, and relax. So again, what I should see there is the palate and the uvula rising in the midline. Again, now if you could have you stick out your tongue for me and move it side to side. All right. So what I've done then is, since I'm already in the patient's mouth, I can evaluate for cranial nerve 12, the hypoglossal nerve, by looking for tongue protrudement, which should be equal in the midline. Finally, we're going to check the spinal accessory nerve by checking for movement of the sternocleidomastoid and the trapezius. So I'm going to ask you to shrug your shoulders and don't let me push them down. So hold them up. Okay, you can relax. And now having the patient turn their head against my hand. So just turn your head against my hand, and now the other direction. Right. So we have equal strength bilaterally by testing both of those segments of the spinal accessory nerve.